Hello again, Diane with Allied Health Career Training. Okay, mother and baby care. So occasionally you may take a client that is a new mom, and usually if you have one of these, it's either the mom or the baby has a problem, is having difficulties. If it's the mom, your job is to do as much around the house to free the mom up so she can have time with the baby, so we can make sure they bond. Okay, your job would not be primarily to take care of baby all the time while mom's doing stuff around the house. You want to take care of everything else so mom can focus on baby. Okay. Of course, you will need to help with some baby care, but your main focus would be easing everything else up so mom can focus on taking care of baby. That makes sense, doesn't it? A few other things I just want to talk about. As you probably know, like this says here, back is best. Used to be we'd put a baby on their side or on their belly. Now we know they need to, an infant should sleep on their back. Okay? Back is best. Next thing is you should not have a crib full of stuffed animals, blankets, all kinds of stuff. It really needs to just be the mattress, the crib, the bottom sheet, and the baby on there. Because SIDS is a real problem, sudden infant death, and so choking, breathing issues, we just don't want any of that. We need to keep everything free from being right around the baby. Okay. Next thing, this size baby shouldn't get something stuck in their throat, but a little bit older baby, maybe like 3, 6, 7, 8 months old, might. And if that happens, you need to follow the correct way of doing a modified abdominal thrust or choking protocol for an infant, which I don't want to get too much into details because, again, they change those every couple of years slightly. But the main things don't change, and that is you're going to want to support the neck at all times. And when you're doing a choking protocol on an infant, I always tell people you make a baby sandwich, kind of like this. And you go like this, and always have this here like this, peace sign, up with the chin like this. And you're doing 5, well, right now it's 5, it might change, 5 blows on the back like this, and the baby should be kind of angled down. But you've got this really good, they're secure. Okay, and then if you need to do a chest compression or whatever, you have everything right here, and you can just rotate that infant back and forth like this. With the infant, of course, you get 911 going right away. Take your BLS, your CPR, and keep it current, because little things change and you got to keep up on it, okay? But babies choke. Babies choke a lot, and you need to know how to deal with that. I also want to talk to you about the soft spot on their head. On a small infant, they have a soft spot right here. It usually will be indented. It'll go in a little bit. That's normal. That's normal. The skull fuses as they age, and to have a soft spot here is totally normal. But it should always be indented. Now, if they're crying really hard and throwing a fit, it may not be indented. But if the baby's not crying hard, it should always go in a little, and that's normal. There's nothing wrong with that. That's normal. Okay. Always just remember to support that neck. Never leave a baby alone in a bathtub, even if it's just 2 inches of water, half an inch of water. You never leave a baby alone in a bath or around any amount of water. ever, for any length of time, okay? And read the unit well, because there's several questions on your state exam on it.